Diverticular bleeding. What are endoscopic interventions? Imagine a tiny pocket in your colon suddenly causing a flow of blood that needs quick attention. When diverticular bleeding happens, doctors have several minimally invasive tools to stop it during a colonoscopy. These endoscopic interventions are designed to find the exact spot of bleeding and control it effectively, helping patients avoid more invasive procedures like surgery. One common method is endoscopic clipping. This involves placing small metal clips directly onto the bleeding vessel or the visible bleeding site inside the diverticulum. These clips work like tiny staples, applying pressure to the vessel to stop the bleeding. Clipping is popular because it is simple, quick, and safe, making it a first choice for many doctors. It causes minimal damage and can be done during a routine colonoscopy. Another effective technique is endoscopic ligation. This method uses a special device that suctions the bleeding diverticulum into a cap and then applies an elastic band around its base. The band compresses the blood vessels and cuts off the blood flow, helping to stop the bleeding. It also removes the diverticulum from the colon wall, which lowers the chance of rebleeding. Ligation works especially well for bleeding from diverticula on the right side of the colon and has shown to reduce the risk of repeat bleeding episodes. Though generally safe, rare complications like delayed perforation can happen, especially in older adults. Thermal contact therapy uses heat to coagulate the bleeding vessels. Devices like heater probes or bipolar coagulation deliver heat directly to the site, causing the blood vessels to clot and stop bleeding. While effective, this method carries a slightly higher risk of tissue injury compared to clipping or ligation, so it is used carefully. Endoscopic detachable snare ligation is a less common option. It involves placing a snare around the bleeding vessel to occlude it, similar to ligation but with a different device. It is simpler but not as widely studied or used. Injection therapy is another approach. Doctors inject agents like epinephrine around the bleeding site. Epinephrine causes blood vessels to constrict temporarily, reducing bleeding. Often, injection is combined with other methods like clipping or thermal therapy to improve the chances of stopping the bleed completely. Guidelines recommend endoscopic therapy for patients hospitalized with significant diverticular bleeding. These procedures are preferred over surgery or radiologic embolization, when possible because they usually have fewer complications and lead to shorter hospital stays. It's important to note that diverticular bleeding typically occurs without active inflammation, meaning it is usually a mechanical injury to blood vessels rather than an infection or inflammation. In summary, the main endoscopic treatments for diverticular bleeding include clipping, ligation, thermal therapy, and injection. Clipping and ligation are the most common and effective options. These procedures help control bleeding quickly, reduce the chance of recurrence, and improve overall outcomes. Always remember, treatment choices should be personalized and discussed with healthcare professionals to ensure the best care for each individual.